Donald Trump's physical and mental deterioration that we've been covering here at the MeidasTouch Network was on full display to the entire world on prime time as Donald Trump gave that disastrous address to the nation. You know, sometimes we forget that while we have a very big audience here, the biggest audience in the MeidasTouch Network on YouTube and covering the news, there are some people who just don't watch the news and they may be watching their primetime shows, and Donald Trump interrupted their primetime shows to give this national address where it basically seems that the United States and Israel are going to continue to escalate the unlawful war in Iran, or there's no sign of de-escalation. But I think Americans got to see the very slurry, lethargic, the very kind of slow, deteriorating Donald Trump that we've been talking about. I know they've been a lot of friends of mine who don't even watch lots of political news. We're like, hey, did you see that? I mean, this guy is like cognitively declining. This guy is like rotting before our eyes. Like, what in the world? I said, I know. We've been covering it here on the MeidasTouch Network, and I've been seeing lots of people calling for the 25th Amendment to be invoked immediately. People are like, something's got to be done. That's the guy right now who's making these calls, who are putting our troops in harm's way, who's destroying our alliances. I mean, by the way, even people like Alex Jones, okay? You don't get much more kind of right-wing extremist than Alex Jones. He's out there now saying Donald Trump's got some major issues. Here's what Alex Jones said. Let's play this clip.
Ankles swell up 3 times the size they were before. That means heart failure. And he does look sick. And he does babble and, sound like the brain's not doing too hot. And so we just cut bait on Trump, and we just mobilize against the Democrats.
I mean, that guy was a Trumper. I mean, you don't get much more Trumper than that guy right there. I mean, the day began yesterday with Donald Trump talking about the speech he was going to give, and he's like, I'm going to give a little speech, and it's about how great I am. Here, play this clip.
And tonight I'm making a little speech at 9 o'clock, and basically I'm going to tell everybody how great I am. What a great job I've done. What a phenomenal job. What a phenomenal job I've done. But seriously, if you didn't have me, if you had some different type of a president.
I mean, it's very strange behavior, and the people there laughing and encouraging that behavior. It's not good at all. So then he gives the speech, and I'm not going to do the whole speech again. I'm just going to pick out small portions, like when Donald Trump was like, we've got the cards, Iran, we've got the cards. What cards do you have? They control the Strait of Hormuz. Here, play this clip.
We have all the cards, they have none. It's very important that we keep this conflict in perspective.
And then the way he described the war was blowing up Iran, the country, to the Stone Ages, their electrical grids, their infrastructure. He's not saying the regime. He's saying we're going to blow up the country to the Stone Ages. As I've said, he sounds like the cartoon character, the corny bad guy cartoon characters I grew up with. Here, play this clip.
We're going to hit them extremely hard over the next 2 to 3 weeks. We're going to bring them back to the Stone Ages where they belong.
I'm not going to show you much more of the speech, but earlier in the day, this is where Donald Trump was then kind of saying, we can't take care of daycare. We're a big country. We're fighting wars. So we can't do daycare, Medicaid, Medicare, and all of these things. What do you think? You think the purpose of this, of what you're doing, is to take billions of dollars to drop bombs and kill little girls in elementary school? Is that what you think your job is? Here, play this clip.
Because the United States can't take care of daycare. That has to be up to a state. We can't take care of daycare. We're a big country. We have 50 states. We have all these other people. We're fighting wars. We can't take care of daycare. You got to let a state take care of daycare, and they should pay for it too. They should pay. They have to raise their taxes, but they should pay for it. And we could lower our taxes a little bit to them to make up for, but it's not possible for us to take care of daycare. Medicaid, Medicare, all these individual things, they can do it on a state basis. You can't do it on a federal. We have to take care of one thing: military protection.
We got to do the military. We can't do good. And then he doesn't finish his sentences. I want to bring in Dr. Vin Gupta, who leads Meidas Health. Dr. Gupta, it's great to see. I mean, look, you and I have been covering this for a very long time, Trump's physical cognitive deterioration, by just observing his and sharing opinions. I mean, you're sharing your opinions as well. The world, we forget sometimes that other portions of the country don't necessarily see all of this, although we have a very big audience. And now lots of people are saying, whoa, I saw that speech. What did you make of the clips I shared and the speech in general, Dr. Gupta?
Yeah, Ben, there was this sort of, just building on our conversations over the last year, I thought today really brought into stark relief some of these topics we've been talking about. Again, no physical exam. We're taking the optics of what we're seeing, what we're hearing, and we're asking some questions. But one, some common takeaways, the juxtaposition of the "we're almost done" theme with "more strikes are coming," that's confused, almost incoherent thought processes, not linear thinking, not consistent thinking. He's drifting in his word structure. He isn't completing sentences, as you pointed out. There is sort of erratic decision making. I have my notes here. There are constant examples of inconsistencies in his thought. These juxtapositions of seemingly paradoxical policy positions. Again, sort of things are wrapping up, but we're going to bomb them into the Stone Age. I think all of these, in addition to the word finding difficulties, the fact that he can't articulate basic words clearly, does make one again ask, is he functioning cognitively? Is he fully there? Is he passing? He talks often about passing basic cognitive assessments. That's one thing. And, flexing that he's passing a basic cognitive assessment doesn't really mean much, because you aren't supposed to be repeating those tests frequently. That doesn't really yield anything from a clinical standpoint if you're repeating a basic cognitive assessment every month. That's not something that typically is warranted, unless there's a reason first. But then secondarily, we're clearly seeing signs of cognitive decline. These are not normal ways to give a speech. And just his thought process, his sentence structure, his ability to articulate a speech, just the fundamentals of it, are all seemingly impaired. And I think if anybody's just watching this, sort of politics aside, if you're just listening to the speech, maybe not even looking at it optically on a TV, you'd be hard pressed not to come to that decision.
Especially we see it later in the night. I mean, it's always there, but oftentimes any speech that's after, let's say, 5 p.m. East Coast, I know some people refer to that as like sundowning, or, I don't know if that's necessarily just a descriptive term, but there is, this after 5 p.m., 6 p.m., the slurring really gets pronounced, the dozing off, and then we see him many times, even in afternoon meetings, fall asleep, and then the people around him are always bragging, oh, he just stays awake, he never goes to sleep. I'm like, we see him sleeping at meetings quite frequently, and when he gives a speech like that, it's low energy, slurring, and it gets worse at night. What do you make of that aspect?
So I think here's where I would draw a distinction. I agree with everything you just said. I do think that whenever he is giving a public speech or a presentation in the evening, it does appear to be that there is some sundowning effect, that it seems like he's just not as sharp and spry. Some would say, well, you know what? He's the oldest president in the office, and that comes with age, especially later in the evening. That typically happens as we age, that we're not going to be as vigorous in the later hours of the evening. We might slur our words. Fine. So somebody may suggest that you're just not as spry cognitively in the evening hours. Let's take that at face value. Okay. But what we don't expect to happen, and what is not necessarily a sign of normal aging, is erratic decision-making. This juxtaposition, again, seemingly a paradoxical policy prescriptions, not completing sentences, jarbling basic words, inconsistencies throughout. That is not necessarily a function of age. And so whereas some people may say sundowning is a function of somebody just getting older, not being the same, say at 10 a.m. as they are at 8 p.m., fine. From a medical standpoint, we can expect that with age. We don't expect all the other traits, Ben. And that is consistent now over the course of the first year of his second term, where these features of all his speeches seem to be consistent. He can't get through a speech clearly. He has word finding difficulties frequently. He can't pronunciate words that aren't complicated words often. And he seemingly makes one statement that's pretty grandiose and erratic and then contradicts it often a sentence later. So that's not clear linear thought. And so anybody that was just, again, listening to the speech and the content of the speech, if they were reading it, they're just reading the thoughts, you'd have to come to some version of a conclusion that something is not correct from a cognitive standpoint and that there is evidence of decline. I think you and I have been talking about this honestly. I think we're asking the right questions. We're wondering why his doctors don't know that he got a CT instead of an MRI, why they're putting out editorialized versions of his physical exam and saying he's the healthiest president ever. There's not transparency coming from his physician team. So we're asking questions. And I think it's fairer for us as part of the media ecosystem to ask questions and also to call out what's now obvious to all of us, that there is clear evidence of cognitive decline.
Then finally, I want to get your reaction to the statement that he made earlier yesterday about how because we're such a big nation and because we're such a wealthy nation, we can't take care of daycare, we can't take care of Medicaid, Medicare, and all of these things because we have to take care of the military. I mean, that's exactly what he said. And what's your take on that, Doc?
Really troublesome, and I think consistent with the first discussion here on his cognitive decline and just consistency of thought. Here are the facts for our audience. Medicare is a federally run program, Ben, created under the Social Security Act back in the Lyndon B. Johnson administration. It's funded primarily through payroll taxes and federal revenue. There's some basic structure nationwide. It's run entirely by the federal government. It is run entirely by the federal government. He is suggesting that states should take it over, as though that can just happen overnight. Medicaid is a federal-state partnership, but it's largely funded by the federal government. The combined set of programs, $1.5, $1.6 trillion, largely federally funded. That's under federal statute as well. This is not something, again, that states can just increase some state taxes and take this over tomorrow. No, that requires a significant overhaul of the tax structure. That requires congressional approval, which is not easy to do, and a whole redo of our basically health insurance ecosystem and infrastructure that is now federally run. So this notion that the states, put aside daycare for a second, because we have a very sort of patchwork approach to daycare across the country. Medicare and Medicaid are formal programs run by the federal government largely. And he is now saying that the states, that these are now the responsibilities of states. That is a significant statement. And if he meant it, one wonders who's advising him, or is he riffing? Does he know what he's actually talking about? Does he understand the implications of what that statement that he made today, seemingly off the cuff, those implications? Does he understand any of that? Because if you're a Democrat running in 2026, you should be running on that statement that he wants to transition Medicaid and Medicare to state-based programs. And here's why this matters, Ben. If that's actually what he's saying, and states are now, he wants states to run them, state taxes to somehow make up for federal taxes. Clearly, the wealthier states are going to be able to provide greater benefits, greater health care, if this were to happen one day, to their people than non-wealthy states, if this is truly a state-based program. So that means, frankly, purple and red states are likely going to struggle a lot more giving basic health care to their Medicare and Medicaid recipients than blue states, which tend to be richer and, frankly, far more resourced. And so this has enormous consequences. So just like he has $200 billion for 3 months of the Iran war, and that is clearly a priority, the fact that he's saying this, every Democratic candidate, frankly, the American public should be paying attention to this statement. He's not interested in making Medicare and Medicaid as strong as possible. He wants states to take it over. That's fundamentally not what's in the statutory law today. And two, there's no way states can actually do what he's suggesting that they can do well. It's not possible. And people will suffer if that actually were to come to pass one day.
Dr. Vin Gupta, one more clip I just want to share before we go. There was just another moment during his speech that I know a lot of people are pointing to say, is he saying nuclear black belt? Like, what is he even talking about here? Just play this clip.
Brilliance of the United States military. Tonight, every American can look forward to a day when we are finally free from the wickedness of Iranian aggression and the specter of nuclear blackmail. Because of the actions we have taken, we are...
Again, I mean, he's trying to say blackmail. I mean, is you know what he's trying to say, but it's the words don't. Anyway, you've covered it all. We appreciate you, Dr. Gupta, as always. Thanks for breaking it down, and thanks for also addressing that point where Trump says, we're such a big nation, we're so wealthy, we just need weapons, and we can't do any of these programs. Thanks for joining us, Doc.
Thanks, man. Appreciate you.
Dr. Vin Gupta, Meidas Health. Make sure you watch and listen to his Meidas Health that we release here on the MeidasTouch Network, his videos, his audio podcasts, and then subscribe here. Help us get to 7 million subscribers.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.